Ezetimibe is a medication that can be given to you when you have elevated levels of cholesterol. This medication is well known by its brand name, Zetia. It is classified as a cholesterol absorption inhibitor. It helps in reducing the absorption of cholesterol from your intestines. Another group of medications can also reduce the absorption of cholesterol by interfering with its absorption. Bile acid sequestrants can reduce the biliary absorption of cholesterol by forming an insoluble complex with it. Therefore, they can reduce the cholesterol levels in your body. However, ezetimibe is not acting like bile acid sequestrants. It has few advantages compared with them. First, it is not forming any complex. Instead, it is going to inhibit a protein that is responsible for the absorption of cholesterol. Therefore, it is highly specific, and it only prevents the absorption of cholesterol with minimal effect on the absorption of other lipid substances. On the other hand, bile acid sequestrants form a complex with lipid components in the diet. Therefore, they can inhibit the absorption of lipid-soluble vitamins and lipophilic drugs. They reduce the absorption of lipid-soluble vitamins like ADEK, as well as inhibit the absorption of lipophilic drugs like digoxin. Such interaction is not observed with ezetimibe. The second advantage is that since it is not forming any insoluble complex, ezetimibe is not producing any troublesome gastric side effects, which are observed with bile acid sequestrants. Bile acid sequestrants form a complex, and they may produce a few of the gastrointestinal side effects. They're actually positively charged, and they can form a complex with negatively charged bile acids. However, they produce nausea, constipation, bloating, flatulence, and abdominal pain due to their inhibition of absorption in the intestine. They also interfere with the absorption of other lipophilic drugs. They're not absorbed from the gastrointestinal tract. Therefore, they may interfere with the absorption of other medications. Such interactions are not observed with ezetimibe. The third advantage is that this ezetimibe can be combined with statins. Particularly, it can be combined with simvastatin and atorvastatin. It can also be combined with fenofibrate. Ezetimibe can be used either alone or it can be combined with other medications like statins. It can be given for the treatment of elevated levels of cholesterol. This condition is called familial hypercholesterolemia. It can also be given in another condition called cytosterolemia. It is a rare genetic disorder and involves a condition of elevated levels of plant sterols in the blood obtained from the diet. In this video, we will cover important information about ezetimibe. First, let us see how this medication works. Cholesterol in the body can be classified as bad cholesterol and good cholesterol based on how they affect a few disorders in your body. LDL is considered bad cholesterol because it is involved in the formation of plaques on the inside of the blood vessels, which arrest the blood flow and increase the risk of atherosclerosis. On the other hand, HDL is considered good cholesterol, which reduces by decreasing the availability of cholesterol within the blood vessels. Elevated levels of LDL cholesterol always increase the risk of atherosclerosis and cardiovascular complications. However, the liver can control these LDL levels in the blood. The liver can synthesize the cholesterol, and it can also get the cholesterol from the intestine after the absorption of the diet. When the levels of cholesterol in the liver are reduced, it increases the uptake of LDL from the blood. Therefore, any factor that reduces the levels of cholesterol in the liver may increase uptake of LDL from the blood, which reduces the risk of atherosclerosis. Ezetimibe helps in reducing the absorption of cholesterol. When you take the food, it contains fatty components like cholesterol, which are going to be absorbed into the systemic circulation through the brush border of the intestine. Here, one of the transporters is responsible for absorption that is called a sterol transporter. One such type of transporter is NPC1L1. It is a protein that is responsible for the absorption of cholesterol specifically. Ezetimibe blocks this protein, thereby preventing the absorption of cholesterol into the body. This results in the decreased amount of cholesterol that reaches the liver. Now the liver needs more cholesterol. It is going to increase uptake of cholesterol from the blood. This reduces the amount of bad cholesterol, LDL, in your blood. How to take this medication? You may be given ezetimibe either alone or in combination with statins. As a monotherapy, it can be used at a dose of 10 milligrams along with diet control to reduce the cholesterol levels. It can be combined with statins like atorvastatin or simvastatin. At such combinations, it can be used at the same dose of 10 milligrams. However, the dose of statins is properly adjusted based on the requirement in reducing cholesterol levels. Effect on muscle. With the use of ezetimibe, you may observe muscle pain, tenderness, or weakness, and it is also associated with elevated levels of creatine kinase. This indicates a condition called myopathy, and it can even produce another condition called rhabdomyolysis. If you observe these symptoms, you should be careful and immediately discontinue this medication. Rhabdomyolysis is a serious condition that involves damage to the muscle, leading to dark-colored urine, confusion, weakness, muscle pain, vomiting, and irregular heartbeats. However, ezetimibe is not directly involved with myopathy and rhabdomyolysis. Generally, when you combine this ezetimibe with other medications like statins or fibrates, which are again used to control the cholesterol levels, then myopathy and rhabdomyolysis may be more pronounced. If you develop such conditions, you should discontinue this medication along with statins and fibrates. Use with statins and fibrates. You should be very careful when you're combining ezetimibe with other medications like statins or fibrates. To produce better control on cholesterol levels, ezetimibe is generally combined with statins. Statins produce a strong reduction in LDL cholesterol levels, and their action can be further enhanced when they are combined with ezetimibe. Statins like atorvastatin or simvastatin are commonly used with ezetimibe. Fibrates can be used as alternatives to statins in those who are less tolerant of them, or they can be used in conditions of elevated triglyceride levels. However, many fibrates are not safe to be combined with ezetimibe. Fibrates like fenofibrate are generally combined. In such conditions, ezetimibe should be carefully given as it may increase risks of statins and fibrates. Use in liver impairment. In people with liver impairment, the levels of ezetimibe may be elevated, leading to its more effects on the body. Therefore, people with mild hepatic impairment should use this with caution. However, it is not recommended in people with moderate to severe hepatic impairment. Ezetimibe can increase your hepatic enzymes. Around 3 times an increase in the upper limits can be observed. It can increase the alanine transaminase and aspartate transaminase levels. Again, this effect is less observed when you're using the ezetimibe alone. However, in most of the conditions, it might be combined with statins, which may increase the risk of elevated hepatic enzymes. Cholelithiasis. Cholelithiasis is a condition of formation of gallstones. Cholesterol is one of the important sources for the formation of gallstones. Therefore, people with elevated levels of cholesterol may have an increased risk of the formation of gallstones. Ezetimibe can reduce the absorption of cholesterol in the intestine. Thereby, it can prevent the formation of gallstones. However, when it is combined with other medications, the risk may be increased. Fenofibrate is a medication that can induce cholelithiasis. Therefore, when this ezetimibe is combined with fenofibrate, the risk of gallstones may be elevated. The presence of gallstones can induce few symptoms. You may have abdominal pain that usually starts after eating. A constant pain along with nausea and vomiting can be observed. You may also have indigestion and bloating. All these symptoms may indicate the formation of gallstones. Therefore, when you're taking ezetimibe along with fenofibrate, you have to closely monitor these symptoms, and if it is required, a gallbladder study should be conducted. This is particularly important when you're taking this combination for longer periods, where the risk may be enhanced. Use in renal impairment. Ezetimibe is excreted by the kidneys. Any dysfunction of the kidneys may lead to the elevated levels of this medication in your body. When the creatinine clearance levels are less than 30 milliliters per minute, it may indicate a severe renal impairment. In such conditions, ezetimibe should be carefully used. This is more important when you're taking ezetimibe along with simvastatin. In case of moderate to severe renal impairment, the dose of simvastatin may be limited to 20 milligrams. Cyclosporin. If you're taking cyclosporin along with ezetimibe, you should be careful because this combination may produce a significant drug interaction. It may result in the increase in both ezetimibe as well as cyclosporin levels in your body. Ezetimibe levels are more excessively elevated in people with severe renal insufficiency. Use with bile acid sequestrants. Bile acid sequestrants like cholestyramine can interfere with the absorption of ezetimibe. They form a complex with lipid substances, and it is non-absorbable. So if you're going to take cholestyramine along with ezetimibe, it forms a complex with this medication that reduces the absorption of ezetimibe into the body. Therefore, when you take the bile acid sequestrants like cholestyramine, take ezetimibe at least 2 hours before or 4 hours after taking these bile acid sequestrants. Side effects. When it is used alone, this medication can produce few side effects like upper respiratory tract infections. You may have sinusitis or influenza. You may also have diarrhea, pain in extremities, and weakness. If it is combined with statins, it can produce few side effects like nasopharyngitis, muscle pain, joint pain, and back pain. It can also increase the liver enzymes. Loss of sensation, dizziness, and headache are also observed. Rarely, it can produce a few of the hypersensitive reactions leading to anaphylaxis, rash, and urticaria. These are the essential things about this medication, ezetimibe. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.